Hello, Dr. Mark here from Adjusted Chiropractic, and I bringing to you today some latest research. If you can picture it, a 13-year-old boy with recurrent ear infections or happening time and time again for parents, sleepless nights, a lot of pain in the ears, recommendation of surgery to get tympanostomy, which are if you've ever heard of grommets. So I'll explain that as well and what that is. Yeah, some fantastic research that's actually just been published very recently, and quite amazing difference for this young boy. And what the literature review actually shows is there's many cases like this. Look, and we see many cases in the office of changes similar to this with regards to function of organ systems, glands, when the nervous system is working better. So I'm just going to just go through the press release as well. So here is the press release that we have got out to social media, and I'll have a link also with regards to this. This has been written up by the journal also. But in short, just a summary, the article has actually been published in the Journal of Chiropractic, Paediatric, Maternal, Family Health, and it did present compelling evidence of the resolution of recurrent bilateral acute otitis media, which is both side ear infections in a 13-month-old child following subluxation-based chiropractic care. So here is the article. I will actually put a link in to all our social media as well. Now, I just wanted to show what otitis media is. So I'm just going to change the screen here. And this is just quite a simple picture of the ear, normally how it should look, and then also when it is infected or when it actually. Another a lead up to ear infections can be fluid in the ears, or also called glue ear, because it's like very sticky sort of fluid in the middle ear behind the eardrum. So the way this works here is this is the ear canal. So just my cursor here is on the canal coming in from the ear from the outside world. What happens is sound coming in here vibrates the eardrum, which is this here, and then that shakes the three auditory bones, or vibrates the three auditory bones, and then that then sends the message into the brain, and then we hear, and that's how it actually functions. Now, in the middle ear, when there is fluid in there, what should normally happen is the fluid should drain out of the middle ear, out through the tube here called the eustachian tube, and it actually drains into the back of our nose, into the back of our throat. So it's a tube that drains there, but sometimes these tubes don't drain. So what happens is there can be inflammation around those tubes, which block them up, and it doesn't actually drain through. Or there can also be infection in the back of the nose and the throat, recurrent, and then it sort of reinfects into the ears. Now, if you've ever been on a plane flight with an ear infection, or you've ever been around a child on a plane flight with an ear infection, as you go up in the plane, the pressure increases in the ear, and it can't equalize because, and normally it equalizes through the eustachian tube into the back of the ear, the back of the nose, sorry. It is very, very painful in the ear, a lot of pressure in there. Also, a lot of divers experience this as well when they go diving, if they can't equalize their ears. In other words, they can't release the pressure down the eustachian tube into the back of the nose and the throat. Huge pressure, and it does generally lead to infections. So in this case, it's important to understand. I'm also going to, in a second, explain how medically doctors try and alleviate this. Is it successful? Not all the time. They basically put a grommet here to try and allow the atmosphere to come in, but I'll explain that in a second. So, but with regards to getting back to this case, ear infections are one of the most common childhood illnesses and often leads to repeated antibiotic use or surgery like tubes in the ears. Now, chiropractic care identifies and corrects vertebral subluxations to restore proper nerve communication and spinal function. So by improving nerve system function, the function of the eustachian tubes in the ears can be normalized, enhancing the immune response and reducing the frequency and severity of ear infections. The nervous system controls and coordinates all functions of the body, explains Matthew McCoy, the editor of the journal that published the study. He goes on to say structural shifts in the spine can interfere with the vital communication, and by correcting vertebral subluxations, chiropractors restore nerve function and support the body's innate ability to heal. So once again, we go back to the article and we see how it was written up here with regards to objectives, outcomes, and conclusions. And in this case, a 13-month-old was presented for chiropractic care with signs and symptoms of acute infections in both ears. Now, this was happening since the age of 3 months. He had experienced recurring ear and sinus infections, treated with multiple rounds of antibiotics, and due to the persistence of these infections, the ear, nose, and throat specialist had recommended immediately doing operation of both side tympanostomy tube surgery, which was scheduled prior to the chiropractic consultation. So I just do have a picture here of what the tubes actually look like, just to give a bit more of an understanding there. So hopefully this now is coming up in the screen share clearly. But here, once again, we have the ear canal going into the eardrum. And then what happens is the surgeons put a tube here to allow the atmosphere into the middle ear to dry out the middle ear. Because if it can't drain into the eustachian tube here into the back of the throat, it clogs up. It starts to become glue ear infected, becomes very stagnant in there. So that's why the infections actually occur. Irritates the eardrums, and then the ear can't take pressure. So this tube here lets atmosphere into the middle ear to dry it out. Now, there are some problems with this. Firstly is that you can't get water inside the ear. So bathing and swimming pools and even showering and baths are a big problem. You've got to make sure that no water goes into the ears, because it actually can get into the ear and create irritation there. And also not very successful in all cases too, because it doesn't take care of the issue that there is inflammation in the middle ear and also in the eustachian tube. So in cases, generally there are things like gland issues as well, adenoids, tonsils, etc., because the immune system just isn't working correctly. So I'll just move out of that there back to our research paper, just to go back to that. And the parents of this child seeking a non-surgical alternative, the parents opted for chiropractic care. The chiropractor conducted an examination that included otoscopy, paraspinal thermography, static emotion palpation, and thermal scanning. Care was delivered using the Gonstead technique, employing spinal adjustments to address vertebral subluxations. And I'm happy to report the child responded quickly to care with a marked reduction in symptoms following the first adjustment. And by the fourth visit, the redness and inflammation of the tympanic membranes, which are the eardrums, had resolved. As a result, the scheduled tympanostomy, which is the surgery, was cancelled. The parents decided to keep him under ongoing chiropractic care, and he experienced no recurrence of ear infections or complications. So absolutely fantastic result. This is the type of work that researchers are doing around the world, showing just how chiropractic works, how much of it has an influence on the nervous system. And then when the nervous system works well, then the body should heal itself and regulate itself. And case after case, it does just that. So today, I hope you found this paper beneficial. If you would like more information on this topic or have any questions, please contact me. Bye for now and have a healthier day. Have a healthier day.